So Dr. Rob, what do we do about the pain? That was an excellent question asked to doctors all the time. First of all, if you have a pain that's due to some type of trauma or some type of unknown entity, this video is not for you. Please go see your doctor. What I'm going to talk about are for those muscular aches and pains that you experience that are for, it's been going on for a while, or you know it's like an acute muscle spasm, muscle tightness, maybe you know it's a small inflammation, and you have been evaluated by a doctor because of this. So that's what I want to talk about. So first, what is pain? Pain is your brain signal to your conscious self that some tissue damage is happening or about to happen. Like you have sprained an ankle, you fractured a bone, that you cut yourself, that you're getting too close to the fire. These are signals that your brain sends to your conscious self that pull away, stop, some tissue damage is about to happen. Now that's good and appropriate response. Unfortunately, there's also a component of this pain sensation of our brain that will tell us incorrectly that we are going to experience tissue pain, or we are about to experience tissue pain, but we really aren't having any tissue pain at that moment of time. Or the tissue pain and tissue damage has occurred in the past and there should be healing right now, but the nervous system is giving us mixed information. That's the type of pain I'm talking about. It's annoying, it's frustrating, it can be depressing, it can be intense, it's very real, but it's not demonstrating obvious tissue damage, and that's what's so frustrating. Actually, I can talk about it right now and explain it to you. I'm gonna hold my arm up right here like this and hold it for just a moment. The most common reason for this persistent non-tissue damaging pain is due to muscle spasm and muscle tightness, and as well as muscle fatigue. Combination of these factors that leads our brain to communicate to our conscious self that there's tissue damage happening, but there is none. The reason I have my hand up here is because obviously if I hold this up long enough, my arm's going to get tired, my shoulder's going to get tired, it's going to be achy, but there is no active tissue damage. This is just a very simple experiment to demonstrate that we can actually generate non-tissue damaging pain really quickly. The solution, I drop it. So this is just a very localized area. Now, if there's some type of persistent muscle imbalance in our body throughout our musculoskeletal system, some muscles are too tight, some muscles are weak and not working well, that imbalance will lead to some muscles overworking, some others underworking, which ultimately can lead to muscle spasms, muscle tightness, muscle fatigue, and lead to this non-specific discomfort that's scattered throughout our body, that's in the lower back of our hips, down our leg, in our shoulders, up into our neck. And we try to describe it accurately, but it's hard to. And the reason it's hard to is because we're trying to describe number of muscles that are experiencing muscle tightness and muscle fatigue simultaneously, and then our brain is sending those signals to our conscious self, and we just hear this loud noise of pain. That's what we're talking about. So what do we do about these things? Well, in general, the best solution to this type of these type of muscle spasm, muscle tightness is some form of mechanical treatment. And that will include the exercises that I have on my Dr. Rob Rehab.com, as well as my YouTube channel, Dr. Rob Rehab. And I talk about these things on my Facebook, Dr. Rob Rehab, as well as other mechanical tools such as massage, maybe acupuncture, spinal manipulation. So these are things that you could use, and these are the ones that will predominantly help. A combination of mechanical, such as hands-on therapy and some type of exercise, is going to be the best thing to improve this type of pain and discomfort. But are there anything that you can buy over the counter that will maybe be helpful? Maybe. I want to talk about that. And I'm going to talk about some products in just a moment. But I want to address a few things such as ice and heat and some things you don't have to buy. Ice, heat, hot compresses, hot bath, cold bath. Will these things be helpful? They may. They will definitely diminish your sensation of pain at that moment in time. But will they solve the problem of muscle fatigue and muscle tightness? Probably not. But if they help you to diminish the pain and discomfort, well, then that's good. You can give it a try. The real goal of any type of pain modality, of anything you put on the painful area, heat, ice, the real goal for those things is to diminish your sensation of pain for a short period of time so that you can engage in some type of exercise, some type of stretching, some type of aerobic activity, some type of resistance training, something that improves your fitness so that we can improve the muscle balance, so that we can improve the relationship between some muscles so that some muscles aren't so tight, other muscles are stronger, improve muscle balance, which then diminishes the pain sensation. So that's what I have to say about ice and heat on those factors. So let's go to other areas, other products. For example, pillows and mattresses. I cannot tell you what type of pillow, what type of mattress to buy. These are actually pieces of furniture. They're not health products. They're not medical devices. So a manufacturer might say, this is good for your spine, or this pillow is good for your neck. That's still claiming that a piece of furniture has some medical benefits. No doctor can tell you which pillow and which mattress you should buy. We can't evaluate you and determine what's the best thing to purchase. So please, unfortunately, we can't do that. Now, the only recommendation I can tell you that seems to be reasonable is for pillows. Laying on your side, you should be able to stick a pillow between your shoulder and your neck. That way the neck can stay a little bit straight. The pillow should provide some comfort, maybe. So that's about what I can tell you about the pillows accurately. You're probably better off laying and sleeping on your side and on your back. So, and putting a pillow or a soft cushion between your knees so that your spine can be as straight as possible when you're laying on your side. Laying on your stomach seems to be the least beneficial to our spine, particularly because you have to turn your neck. So maybe put a tennis ball or a small golf ball, tape it or sew it onto a t-shirt, and every time you roll on your chest, you wake up, and then you learn over the course of several weeks to continue sleeping on your side or your back. So that's my recommendation when it comes to sleeping and pillows. Make sure that whatever mattress you have seems to be fairly flat and not broken, and whatever pillow allows your neck to stay relatively straight. All right, so let's go on and talk about some other products.